Nursing has been called the oldest of arts and the youngest of the professions. The origin of the word nursing comes from the Latin word which means to nourish. To nurse, therefore, means to wait upon, while a nurse is the person who tends to the sick. Being present during childbirth, taking care of the young, tending to the sick, caring for the old and those who were near death have historically been associated with women's responsibilities. Yet, those responsibilities were mainly contained within the realm of one's household. These all changed with the advent of Christianity. Christ's teachings of love and charity transformed not only the society, but also the development of nursing. Devotion and service to others brought rise to altruism. The rise of Christianity gave women opportunities to social service. At first, diaconesses would care for the sick, the orphans, the aged, in the buildings that were built by the church. These hospitals were not medical institutions and served primarily for the care versus the cure of those who were admitted to it. As monasticism became more prominent after the 6th century AD, these institutions were organized as a place for those who wanted to serve God. Monastic orders and hospices were formed in the monasteries, which were devoted to shelter and comfort of the poor and the sick. The monks and the nuns practiced nursing and medicine without distinction, yet they laced it with mysticism, religious faith, and superstition. The 10th century brought the Crusades, and with it the need for military nursing. The military nursing orders were created under the name of Hospitallers. The members of these orders were knights, priests, and serving brothers. Several hospitals were established under these orders in Jerusalem, Palestine, and Malta. As they were financed by knights, these hospitals became institutions of remarkable splendor. Yet, as crusaders were forced to retreat back to Europe, the idea of building such hospitals was abandoned. In the Middle Ages, great poverty took place. The rise of the urban growth brought nursing back into the community. This gave rise to mendicant orders, which were religious missionary bodies. The Franciscans and the Dominicans, and later the Carmelites and Augustinians were created. The Tertiaries was another order that was founded for the ladies of both sexes. These carried religion into everyday life through unselfish and useful service to society. Many other orders followed, called sisterhoods or brotherhoods, which devoted themselves to the care of the sick poor. Yet, as time passed, church reformation brought deterioration to the hospitals where unsanitary conditions prevailed, and outbreaks and epidemics were common. Religious nursing orders continued their work. At the same time, nursing went through a dark period, as lay nurses were often illiterate, rough, inconsiderate, and immoral. Prisoners and even discharged patients could be nurses. One of the orders that prevailed through those dark times was the Sisters of Charity, who were formally trained for 5 years and were required to wear a uniform dress. The birth of modern nursing took place in Germany. The Diaconess Institute in Kaisenwerth was formed in 1836. The training of the diaconesses was 3 years long and prepared them both for teaching and nursing. The teaching in nursing included rotation in the wards for men, women, and children. It also included bedside instruction, religious indoctrination, ethics, visiting nursing, and enough pharmacy instruction to pass the state examination for pharmacists. The nurses were required to follow the physician's orders exactly. This is where Florence Nightingale studied nursing.